Welcome to the Reimagine Aging Conference. Please take your seat if you haven't done so yet. That would be really appreciated. All right, we're going to kick off. It's 10 a.m. So my name is Jean-Luc Sibyl. I'm the CEO of Allianz Investment Management and also the CIO, Chief Investment Officer of Allianz Life. Very honored to be here today. I'm also honored to be part of the board of Senior Community Services. This is a fantastic event. We wait for it whole year, and we've been sponsoring it from Allianz for the 8th year in a row. So that really shows the commitment we have to SCS. So Allianz Life has been sponsoring here the event because we are committed to the same values that we see with senior community services around inclusion, the compassion, and the community. We are selling products for people while they are aging to ensure their financial strengths. We see also the same mission in SCS in really caring for a population that is aging. So that is really something that speaks to us a lot. On a personal note, I mean, I have my parents living abroad and I see them aging, and I just love the idea that there are people volunteering to help others. And so that's really what makes it great to be here. Along with Senior Community Service, please join me in thanking the Benafica Foundation for sponsoring today's keynote panel discussion and welcoming Jennifer Schaefer, Medicare Products Strategy Director for Benafica, to the stage. Thank you, everyone.
Good morning. As JR mentioned, I'm Jennifer Schaefer. I'm the Medicare Product and Director for Strategy, focusing on Medicare Advantage. And if you didn't know, shopping started yesterday for Medicare. So you can switch plans for 1/1/24. Closer, she says. You are with it. Thank you. If you don't know, Medica is a health plan located right here, headquartered in Minnetonka, just 8 miles west. We were founded over 45 years ago. We are in 12 states, and we've done Medicare for over 30 years. But today I'm here representing the Medica Foundation, who has sponsored this event and the keynote panel for the last 4 years. The foundation has granted over $40 million over the last 20 years. So please welcome Medica Foundation. Thank you. I'm also here to introduce the keynote panelists. First, I'd like to introduce Margaret LeClair Lett, right in the middle. Dr. LeClair Lett is a serial entrepreneur, insurance executive, technology innovator, and former professor of econ. She also received her PhD in econ, and Dr. LeClair has founded several other companies, including, for the last 2 decades, Blue World Developments, Benafica, and LeClair Group. Her track record emphasizes organic growth, marketing, and year-over-year profitability. She has also led several software development projects, her newest project being Benafica Health, a universal health records management app that redefines what consumer-directed healthcare means today. Next to her is the other panelist, Kari Seveson. Kari is the co-founder and president of Oasis Health Partners. Throughout her career, Kari has had the opportunity to work in value-based primary care and healthcare systems across the US and abroad. Most recently, she served as Chief Strategy Officer for Mayo Clinic following a 15-year career at UnitedHealth Group. Her journey taught her what great care looks like, and what opportunities still remain ahead. Looking forward, Kari is motivated to make healthcare more resilient, patient-centered, and sustainable. She currently serves on the boards for the U.S. Anesthesia Partners and Spire Health. Today's moderator, right here, Bart recently retired after more than 30 years in marketing leadership roles for Twin Cities companies, including UnitedHealth Group, Best Buy, and General Mills. While working in the Medicare business for UnitedHealthcare, He gained an appreciation for the challenges that seniors face while trying to navigate the complex healthcare landscape. I also learned he just got licensed to sell Medicare, so he can answer your questions. Again, sales season started yesterday. Outside of his professional interests, Bart serves on the board of directors for the Minnesota Opera and guest lectures on marketing topics at local university. Please welcome our panelists today. Thank you.
Okay, and I think that turns things over to me. Hello, everybody. Happy to be here. I'm really excited to be moderating this panel today. First of all, though, thank you, Jennifer, for those introductions, and to Medical Foundation for their sponsorship of this panel. Thank you, JR, for your introduction, and to Allianz for the conference sponsorship of today's Reimagine Aging conference. A few months ago, I received a call from my friend, former colleague, and current Senior Community Services Board member, Chris Pimentel, and he asked me if I'd be interested in moderating this panel. I was really excited for the opportunity, and the reason is that in both my professional and in my personal life, I've had the opportunity to see how health technology can help deliver better health outcomes and better health access for seniors. However, I've also seen how health technology hasn't really fulfilled its promise yet, and in fact, can be a barrier to effective care. Recently, my father, an 85-year-old with multiple chronic health conditions, had an acute issue that sent him to the emergency room for some fairly significant emergency care. And after he was released, his ER provider sent him an email directing him to a website where he would be able to get some additional information, including diagnostic information and follow-up instructions. Now, unfortunately, like a lot of people do, he had trouble getting into the website. The password reset system wasn't working for him, and he gave up. Now, fortunately, I visited a few days later and was able, with some persistence, to get back into the website, navigate my way through whatever architecture the website had, and find the report, which told him that he has diverticulitis and that he should have seen his primary care doctor 2 or 3 days earlier. But he never would have known if he wasn't lucky enough to have an engaged family member and the kind of circumstances that enabled him ultimately to get the information that he needed. Everybody here, is there anybody here who can relate to an experience like that for either themselves or their loved ones? Right. Is there anybody who can't, right? We've all had that sort of experience. And that's one of the reasons why I'm excited to talk to today's panel. We have the opportunity to talk to a couple of people here who are committed to leveraging technology to make healthcare more accessible and more effective for seniors. So let's start with you, Kari. Can you tell us a little bit about how and why you first became interested in the healthcare industry?
I'd be happy to, Bart. So my healthcare journey started when I was a kid. I was born and raised here in Minnesota, and my father actually had a home healthcare agency that supported seniors in southern Minnesota. And it was a little bit of child labor. I spent high school doing appointment scheduling and data entry and all sorts of fun things, and somehow that convinced me I wanted to pursue a career in healthcare. What was funny is I started my career in health insurance working at UnitedHealth Group. I spent 15 years there, and I got a call from Mayo Clinic one day, and they were recruiting me to join as their chief strategy officer. And I thought back to those days when I was supporting my father's rural home health agency and looking out the window from my pile of data entry and thought, wow, that's the ticket. I'm gonna go work at Mayo Clinic. They were headquartered, of course, in Rochester, Minnesota, and my father's home health agency supported that area. And I thought I'd be there forever. But recently I had an opportunity to co-found Oasis Health Partners. And that's where I think my career journey's come even more full circle. We are supporting rural primary care providers in taking care of their senior patients. And as everybody knows, there's a shortage of primary care providers out there. It can be really hard to find a high quality physician, and that gets even more difficult when you think about rural communities that are really underserved. And so at Oasis, we're working to build healthier communities by advancing primary care, and it's really exciting to come full circle, but delighted to be here with all of you and share some of my observations of the healthcare system from the insurance side, the primary care side, and just perspectives on senior patient care.
Now, Kari, I have a couple of quick follow-up questions for you. You and I had the opportunity at UnitedHealth Group to work on the global business. Most people don't know this, but UnitedHealth Group has owned hospitals and insurance companies in Portugal, Brazil, Peru, Chile, and Colombia. Would you say that the challenges that we experience here in the United States are the same kinds of challenges that we see elsewhere in the world?
Yes and no. I think one of the amazing things about working in global healthcare is you realize how similar we all are and how much we all have in common. I think something that was fascinating working with Bart in South America is that it's largely a public health system. So everybody has access to healthcare, but to get access to private healthcare and be able to see specialists more quickly, get into the top hospitals, you really needed that private health insurance plan. And having access to that was like buying a luxury vehicle. And so children would try to get that for their parents. And I just thought it was fascinating in that while it was wonderful, everybody had some level of access, getting that faster access, more care, better care, different specialists is something that we maybe take for granted in the United States. If you need a knee replacement, you could probably get that done in a matter of weeks instead of months or years. If you need an eye exam, that could maybe happen the next day. And that's not necessarily something that's available in every single country. I also thought it was striking how much I learned from healthcare in South America. There were a lot of things that, frankly, I think the United States could take a lesson or two on, especially around data and technology and just the integration.
Excellent, thank you. Now, back to your decision to start Oasis Health. You've seen the healthcare industry from the perspective of the largest healthcare services organization in the world, and from arguably the best healthcare provider organization in the world. What made you so compelled to start your own organization as opposed to try to address some of these challenges in rural senior health from inside of one of those environments?
It's a great question. I think it comes back to my roots. I come from a family of entrepreneurs, and once you kind of are born and bred into that, you can't shake the entrepreneurial spirit. But here's what I'll say. It's amazing to make an impact at scale. And I had an opportunity to do that at both UnitedHealth Group and at Mayo Clinic. And really, I think, was fortunate to learn the best of health insurance and the best of care delivery. But all of the scale and the impact breaks down when it comes down to rural communities. Today at Oasis, we're working with really small primary care practices. On average, our providers are two doctors in a shop. So it isn't these scaled medical systems. I say it's not Mayo Clinic level care everywhere. We're working with small practices, and at the end of the day, primary care is how most people experience the healthcare system about 80% of the time. And it's a really underserved market, and that opportunity to make a difference one practice at a time in the communities that need it most, for the patients that need it most, was really compelling for me. And we're getting a small start, but we're going to start small, think big, and grow fast.
And in what ways, and what types of health technology, and in what ways is health technology really critical to delivery of that mission?
Yeah, so great question. We're serving rural communities, and access is really a problem. Some of our patients that live in these communities might be driving over an hour to go and get care. And it's really important for us to think about how technology can improve that connectivity. We do a couple things. We offer virtual visits, and that's a great way for patients to be able to receive care from the comfort of their home, and we can talk a lot more about that. We also offer nurse practitioners that are willing to come to the patient's home And that works great for some patients. Not everybody wants a nurse coming into their home. So we'll also do community events. We have mobile units, and sometimes we'll set up shop at a Walmart or Target or Dollar General. And when people are coming in to do a grocery run or be in the community, they can also get a flu vaccine or do an annual care visit. And that's worked pretty well. And finally, we do some work around remote patient monitoring. So there's different tags and sensors. We do scales, and otherwise we can talk about today. But what we've really found is that it comes down to the patient and it comes down to the physician and what everybody's comfortable using. And if you throw even the best technology at somebody and they don't have interest, or maybe they don't have the Wi-Fi connectivity, it's going to fall flat. So it really comes down to knowing our primary care providers, knowing our senior patients, and figuring out what's going to work best for them.
Great. So you've got an intimacy that you're going to be able to apply along with technology to really improve outcomes and access.
Indeed.
Great. So Margaret, let's move over here to you. I'll start with the same question that I posed to Kari, which is, as you got started in the healthcare space, what was it that first really piqued your interest? And were there any people in particular or incidents in particular that got you so excited about the space?
Yeah, well, some similarities, and that I come from a family with an entrepreneurial background. So I had an awareness at a young age, of how the business was doing by just being at the dinner table. But my journey really started first on the technology side. After doing a PhD in economics, which probably for me was more getting a PhD in tenacity, I took that experience and I joined 3 friends in a technology startup. And back in the day, we made some of the early software for smartphones. So staying relevant, we made software for BlackBerries and handspring trios and Kyoceras, probably everybody's first generation smartphone, and none of those brands are around anymore. But from there, I went into the healthcare financing world. So primarily on the health insurance side. And I suppose it was the economist in me that was interested by the fact that healthcare has become the largest industry in America. And how we pay for healthcare and how we manage our healthcare is a challenge for every level of government, every business that's providing health insurance, and also every family that's trying to figure it out for the different generations. So that's what really piqued my interest. And over time, one of my pet projects has become the Benji Health application. So Benji, in the interest of full disclosure, is the name of my giant schnauzer.
Is he the inspiration for the mascot that
Yes,
you see on the
so
website?
if you go to the website Benji Health, you will see the mascot. But he's your healthcare buddy. And just given my technology background, this application, Benji Health, you can use it on your computer, on the web with a regular browser. But of course, it's also available on your Apple device, on your Android device.
And your Kyocera and your
Well,
BlackBerry.
no, it's not available on your BlackBerry because nobody has a BlackBerry anymore. But Benji Health is the first independent universal healthcare application. So what do I mean by independent? It's not connected to your insurance company. It's not connected to your provider. If you get your insurance through work, it's not connected to your employer. Who hasn't just felt a little bit of frustration that you're always leaving your healthcare behind, right? You have a change in your life, all through whether you've moved, whether you've gotten married, whether you've had children, how your family's changing, oftentimes those life events are accompanied with having to start your healthcare journey over. Ugh, how annoying, how frustrating. So Benji Health is there for you, for consumers, to provide that continuity. Everything else can change around you, and that's okay because you can help manage that change with Benji Health. Benji Health allows you to organize your healthcare calendar with all of your appointments, your providers, from doctors to clinics to hospitals, systems, your medications, including your vaccines. Does everybody know where they have their documentation for their COVID vaccinations? Your emergency info, your health history, including ongoing tracking of your vitals, your conditions, whether they're chronic conditions, one-time conditions, accidents. You can also put the files in there, your digital files that are your medical records, and you can put your insurances. So if people change to Medica, they can upload their Medica insurance, but they can still have the records from their previous insurance. Again, it stays with you. That's one part of it. The second part of Benji Health, which is my favorite part, is the sharing. Now, probably most of us in one way or another, to some degree, are on social media. Now, you don't want to share your healthcare with hundreds of people. But with Benji Health, you can share section by section with up to 7 people, which helps families. So my mom is a very healthy 79-year-old. She lives 10 minutes away from me, but she does have some chronic problems with her eyes. So my dad said to me last year in April, do you know your mom's had 59 eye appointments? Whoa, she did have a lot going on last year. But because it was with her eyes, she wasn't driving herself to all of those appointments. I'm busy, my brothers are busy, so my mom shares only her calendar and her providers with her 3 adult children. So we know where she needs to be, who she's seeing, we can get those details. And I have a busy day, I run a company, but if my dad says to me, Margaret, can you take your mom on Thursday at 2? The answer is yes. I got it. Don't worry about it. Of course, then I do a little, okay, what's going on Thursday? Right? But I can pick her up. I can check the app. This is where she needs to be. Maybe afterwards, her eyes are dilated, whatnot. I can put in there the follow-up information. If she has a prescription, I can put it in there. Maybe the notes are she needs to be back in 30 days. Okay, I put that in there. But the great thing is when I put that in there for her, my dad sees it and my 2 brothers see it. And then I bring her back home and I run back to work and we're good. And so that sharing of Benji Health is just vital, an everyday, very practical tool for families that are trying to help take care of each other. And it's really helpful in families where there's adult children scattered around the country, all interested in taking care of mom. And of course, it's the person who lives local to mom that takes the biggest brunt of it from the siblings that live on the East Coast and West Coast. And of course, it actually—
Speaking from personal experience, of course.
And it also works great for families where there's blended families and co-parenting going on, and 2 very dedicated co-parents that are putting in information for minor children, and they can keep track of that information for their kids. And again, they can only share what's needed. An adult can have their own account and not share it with anybody else. So that sharing was put together with the utmost mindfulness of allowing people to be protective of the information that they want to be private, but also share with their family members what's really helpful to the family.
Great. So I love the fact that when you started talking about Benji, you described it as your healthcare buddy. And as you talked, one thing that I was thinking was healthcare really is a team sport.
Yes.
Right? And your team includes people that are very close to you, like your children, parents, what have you. Also includes the providers, the insurance company, and all sorts of other people. And you're able to be really smart about how you share the information and let those other team members play their role. Would you say that's one of the big differentiators between what Benji Health does and other sorts of systems and tools and apps and things like that that are doing health records tracking?
Yeah, so other tools out there perhaps have the focus of going really deep in one area, where the advantage of Benji Health is it gives you a broad overview of what's going on. And it's that broad overview that's really helpful for families. And the sharing. So, and the choice to share everything, or of these 6 sections, I only want to share one of these sections or 2 of these sections with this 1 or 2 people that have an interest in that piece.
Okay, so another key feature then is really of Benji is consolidation. And,
Yeah.
and you all probably have, like I do, half a dozen different health apps on your smartphones that you're supposed to use depending on what provider you're seeing or what insurance company it is or what have you. Can both of you share some thoughts on the need for kind of consolidation in health technology, and who's in the best position to provide that consolidation? Is it an insurer? Is it a healthcare provider? Is it an independent sort of app like Benji?
Go ahead.
Well, so when I say healthcare, I know we traditionally think of going to the doctor. That's very legitimate. But healthcare is also going to the dentist. So important. For a lot of people, those visits to the chiropractor are just essential to your wellness. So in Benji Health, you can define your providers according to a much broader range of how you define wellness than just traditional, I'm sick, I need to go to the doctor. So
Okay,
I
so you've
think
got
that's
so this your
comprehensive.
tool gives people the ability to create kind of their own consolidated healthcare ecosystem.
Yes,
Right.
yep.
Kari, what thoughts do you have on kind of the need and opportunity for
Maybe a similar, I would love it if all my primary care providers used Benji with their senior patients. What I will say is at Oasis, we believe primary care and the primary care providers are the quarterback of healthcare. So how many people out here have seen their PCP this year? Not enough. Get in there.
Maybe it's December.
Maybe. So it's really interesting. I think, as you bounce around healthcare, you might see a specialist, you might see a chiropractor, you might go to the dentist, you might see the eye specialist, optometrist. And at the end of the day, we're really hopeful that your primary care physician can be that trusted partner and that point of continuity through everything. So we work really hard with the primary care providers to free up as much of their time as possible so they can spend a disproportionate amount of that with their senior patients. I don't know, for those of you that raised your hand when you saw your PCP this year, I'm not sure how many minutes they spent with you. Hopefully you got more than 5 or 10, but unfortunately, a lot of the senior patients we talk to say that they feel that their appointments are really rushed, that they don't get enough time with their primary care providers to really go through the medications that they're on and the questions that they have and discuss their healthcare concerns. So our goal is to make sure that every PCP has more time with their patients and also the support around them to really complete a comprehensive visit and do that care. So we view the primary care as that foundation and that point of continuity in a pretty fragmented healthcare system.
Sure, and if I were sitting up here as a representative of my former company, as opposed to a moderator here, I might say, hey, look, the insurance companies are actually in an awesome place to be coordinators and consolidators because they see every bill that gets paid. So they know if Margaret is seeing maybe a chiropractor, maybe a mental health professional, maybe primary care physicians, and a few different specialists. So it's really, I think, going to be an interesting evolution to see what types of organizations really come to the fore in this effort to consolidate health, provide better health information, more patient-accessible information, and ultimately better outcomes. So as we think about where health technology has gone, you both have been working in the healthcare space for a couple of decades, and as have I. Where do you see some of the most significant technology evolving and being applied right now on behalf of patients, and specifically on behalf of seniors?
My point of view is that technology is really shifting to be, from a healthcare perspective, in the home. And some exciting advancements that I was working with at Mayo Clinic and now I'm continuing to work with at Oasis is really around hospital at home. We partnered with an organization called Medically Home that can actually deploy services to the patient's home. And it's amazing how high acuity. We had people that were actually getting transplants and were home within a few days. We had folks that had total joint replacement, and the technology's really come a long way so that you can have a hospital level experience of care from the comfort of your home. And I think that's where things are going. And every patient has a preference, but I think all of us feel more comfortable, more secure, more safe, more healthy when we can be at our home base, in our own bed, and feeling relaxed in that way. So I think you're going to see a lot of healthcare technology pointing in that direction.
By the same token, I've experienced in my household kind of a minor feeling of terror upon having somebody released into the home after a significant surgical procedure or a significant accident. Mm-hmm. So this hospital and home capability leverages technology to maintain the necessary connectivity, yes, while also allowing people to recover where they're truly comfortable. Because I think that most people would agree a hospital is a pretty uncomfortable place to be getting better.
Bart, maybe I could tell a tag-on story.
Do.
I think it lands it. So 2 holiday seasons ago, my grandmother, she is 95. She lives in Fargo, North Dakota, and she has congestive heart failure. And she was struggling, and I was working at Mayo Clinic at the time, and we actually got her there, and she spent the holiday in the hospital, which was tough. I was able to sneak my grandfather in, and we had a Christmas dinner together at her bedside, which is really, really sweet. But after that, we were able to get her home, and her goal was to be home by New Year's Eve. And what was fascinating is she was very open, to your point, Bart, to the technology that supported her care. So we actually got her a scale, and she stepped on that scale every single morning to detect whether there was a fluctuation in the water weight, and if she was continuing to retain fluids that would be pressing on her heart and on her lungs, because a 3-pound variation is an indication that you're going to have a congestive heart failure event. But she wasn't very excited about people coming into her home to check on her during that holiday season. So it's very interesting, and I think that's when it comes down to patient preference. My grandmother felt like she already gave up her Christmas being at the hospital and wanted her New Year's with her family, so she loved the scale, but she didn't necessarily want that in-person nurse interference. So what worked for her was doing a virtual visit and just having that consultation, and she was actually able to talk to the cardiologist that had been working on her case through a virtual visit, and then use the scale, and the scale results were reported back. So I think it's really interesting. There are other people that might feel more comforted if a nurse came into their home in person. That would feel good, that would feel safe. that would feel secure, and our ability to just adjust the healthcare system to meet the patient needs are really important.
So the integration of telemedicine was helpful in that particular circumstance.
was.
And with what Oasis is doing, one of the few things that we might actually genuinely be able to say is a benefit of the pandemic is it's become an integrated part of our healthcare system. Technology, evolution of technology. Margaret, what are some of the key things that you're seeing where technology can really make a difference?
Yeah, I think that word integration is key. You mentioned offhand, you have a number of technology apps on your phone. How often do you open them? And so, just being able to have more pieces of the puzzle connected, easily accessible, whether it's using Bluetooth within a small environment, having the data go over the network back to a central system. Those are all things with different kinds of devices that are coming online now more and more and more all the time. But I think that where the big leap is coming is in this area of AI and artificial intelligence. And of course, it's the big question, is this fantastic? Is this going to ruin our society? But I think in the area of healthcare, it can be used in such a positive way, in that so much about healthcare is wanting to be preventative, wanting to have a favorable outcome in the future, and the data analytics that can help us anticipate what's going to come so that we can minimize those situations and have the least amount of harm to our own bodies or to our loved ones is just so important. And I think that is really going to bring a lot of change to healthcare over the next 5 to 10 years.
Interesting, I'm like a lot of people, I'm an Apple Watch wearer. I was a Fitbit user for about 7 or 8 years, and now I'm addicted to this thing. What's interesting is it's a curiosity, right? I love all the data, but it doesn't necessarily do me any good. And if we can somehow apply artificial intelligence with appropriate information about me as a healthcare patient to what's being fed from here, I could potentially have a major health event kind of anticipated or even head off if the right information is being transmitted and connected from this to healthcare providers, insurance companies, whatever it might be, that helps them unlock the potential.
And I think that that comes along with privacy concerns, privacy for your insurance company.
Yeah.
And that's where I do think the insurance company plays such an important role. Despite how expensive your insurance can seem, which it is, there's no better ROI out there when your insurance company is paying 80% and you're paying 20%. So that's a nice thing. But really having an independent source that you feel that you do control it, and all of this good work that you're doing, if you change insurance companies, you're back to ground one. If you move, if you decide to become a snowbird, and then you eventually establish your residency in another part of the country because you're a snowbird, you're back to starting over again. So your privacy, your information, it can do great things. But I know obviously some people feel nervous about maybe the big brother aspect of it.
Sure. So lack of connectivity, lack of trust maybe, are a couple of the barriers that exist to technology, health technology, realizing its promise. What are some of the other barriers that you think about us as a society needing to overcome from a health technology perspective for it really to be able to deliver?
I can hit on one. We primarily at Oasis serve rural communities. And as Bart mentioned earlier, the pandemic was really great in relaxing some of the regulatory restrictions around telemedicine. So physicians can actually see their patients through telemedicine and be reimbursed for it. And that's great for patients, it's great for doctors. But a real challenge is Wi-Fi and just getting that broadband access. None of this technology works if you don't have a good cell signal and a good Wi-Fi connection, and that's a practical reality. I think another piece of it is just some of the attitudes and perceptions toward care. So, when we work with our rural communities, we work really hard to engage the existing healthcare resources that are already there. You don't want to be somebody from corporate coming over the top, feeling like an outsider to this community. People really, I think in any community, don't take well to that, but they trust their primary care provider that they've been seeing for years. And if we can support the primary care providers, then we can in turn support their senior patients. And patients themselves, I know my mother and father-in-law would fall in this bucket. They're not going to go and see their doctor unless their arm's cut off and they're bleeding. They're very tough Norwegian stock, and so I think some of that is just changing the perceptions around preventative care. And hey, it's a good thing to be going to the doctor, and you should probably go to the doctor before it is an emergency, and just getting in a cycle of those regular visits and being connected and checking in.
So that's interesting. There's a little bit of an attitudinal barrier towards
Yes.
healthcare and prevention versus.
And I think it's interesting how you talk about just the regions and the background, and in a rural community, those are some of the perceptions. But I think that's also can be balanced out in an urban community. You could also have lots of hypochondriacs
Absolutely.
that are always going and over accessing healthcare.
Mm-hmm.
So
Goes both ways.
so that's why understanding your audience and
Yeah.
just making sure everybody has the right care and the right care to me has always been defined the quality care at an affordable cost at a time when you need it, when it's appropriate. And those are really the three pillars that any healthcare program and technology used to support it can really define as success.
Okay. So I started out my own conversation talking about my dad, 85 years old. A couple things I didn't tell you about him is that he's an Ivy League college graduate and was a senior vice president with one of the largest companies in the world. Yet he encountered this password-related issue that made it impossible for him to get really vital information on his care. And not only that, it was really depressing and debilitating for him mentally to have run into this issue. How do we two parts to this question, and you can address however you want. One, what sort of health technology is it really important for seniors to become more familiar with and more comfortable with so that they can get the benefits of health technology in their own care? And then how can caregivers, whether those are paid caregivers, children, spouses, how can caregivers, what do they need to do, and how can they leverage technology to really make sure that their loved ones are cared for effectively?
Yeah, I think, I know we've talked about it a lot today, but I view telehealth or telemedicine virtual visits as really the kind of gateway technology for senior patients. And happily, I think through the pandemic, we all learned how to use Zoom pretty well or FaceTime to connect with friends and family. And so I think that virtual visits can be one of the first things that are easy to use and a great way to connect with any healthcare, whether that's your primary care provider, a specialist, et cetera.
And maybe those don't even need to be one-on-one, right? Why couldn't I join a call from
Absolutely.
Minneapolis with my dad in Des Moines and his caregiver
Completely.
or his professional? Yeah.
Yeah, and I think, caregivers are a critical part of it. Bart, to your point, we do a lot of three-way calls, and to the extent that you can have others, whether it's a companion at home, a caregiver, Margaret, to your point earlier, maybe a child that's living on either coast, having that support and getting everybody on the same page. We do a lot of visits where kids are on the call because they want to hear that information firsthand, and it just helps in a big way. So I would say just those virtual visits is a great platform, and to the extent you can do that in a group setting, it really helps.
That's great. And I would suspect that you're probably going to have some favor towards really becoming familiar with that health record, right? And the sharing of enabled by the health record.
That's right. In all of our families, we all have our family members that play certain roles. And the person in our family that's playing the role of getting everybody together. I mean, my family never had a virtual meeting before the pandemic because why would we? That seems so weird. But boy, my brother in Washington, D.C. organized it. And everybody was so happy to see each other, even if it was virtually. And so it has changed. And seniors, yes, healthcare is a big driver to embrace technology, but there's other drivers in our lives and in seniors' lives too. And that driver is simply just being connected to our families. So building off of those underlying connections, letting people use the roles that they already play in their family. And, but it's a little bit negotiable. I think my mom should be sharing all of her sections of Benji Health with me, but no, she's very adamant about it. She's fine. She's got good control of it. If she needs my help in the future, she'll let me know. Okay, that's fine. In the meantime, she has an appointment on Tuesday. Got it.
There you go.
So
great. So we're coming to the end of the time we have for this panel. I do want to save a few minutes for questions from you all, the audience. So this is your cue to tee up anything you've been that's been brewing in your head over the course of the past 45 minutes or so. Any final comments, about a minute or so from either one of you, both of you?
yeah, if you want to look up a Benji Health on your phone or on the website, Benji is spelled Benengi. Just Benji Health. So
Great, thank you. Kari?
Great.
And I'm sorry, could I just go and sign up for Benji Health myself right now?
yes.
Okay.
That's great. So Oasis is not yet in Minnesota. We're serving Iowa and South Carolina and Georgia and many states in the Southeast, but we will be expanding into Minnesota soon. Until we do, I would just put a plug in for the power of preventative primary care. And for those of you that did not raise your hand and you have not seen your PCP yet this year, I would encourage you to get out there and do it. So
Great, thank you. So thanks to both of you. Now I suppose we have time for probably 3 or 4 questions, I would imagine. Do we have microphones? We've got a couple, one right here in front. I'll ask you to wait for the microphone so that people can hear your question. Thank you.
So to the example you were giving about your father having trouble with the password, it does seem like security is one of the big barriers, particularly for seniors. And despite the cumbersome nature of it, it's imperfect. There's breaches all the time. So maybe for our panelists, do you see any advances coming with security that will make these apps easier to use?
Well, usually security is on 2 levels. For Benji Health, there's an initial registration. And then once you're registered, it's a username and password. But the registration does have a number of steps. So if the 2-factor authentication, a secure code that you have to put in, Healthcare apps today are really following the standards set by the banking industry. The banking industry is really, I think, kind of a leader, a heavily regulated industry. Most people today use their online banking. It's just become normal. And that's sort of motivating to me. If the banking industry can manage to create that adoption, so can healthcare. So I do break it down into two categories. That initial registration can be a little trickier. I watched my own mom get a little confused, but I've watched the 25-year-olds whiz through it, and that's just the way it goes. So, but to that point, don't let that initial registration turn you off to the process, because after that, it's just your username and password. It's a breeze. So is it going to get any easier? Probably not, because security is so important, to be honest.
Kari, any thoughts?
Yeah, I'd echo Margaret's comments. I do think that security in healthcare is advancing, and some things that encourage me is you see a lot of platforms trying to come together. So health information exchanges, or organizations trying to have EMR interoperability, and everybody just get on the same page, on the same platform, adopt the same security postures. I also think there have been great advancements in just consumer-facing technology. So instead of having the password like Bart's dad was struggling with, just face identification like you would to unlock your phone, fingerprints, other things like that that make it, frankly, easier and more secure.
Yeah.
Great, thank you.
Good question.
Question back over there. Is there a fee associated with the Benji website, was the question.
Yes, the Benji is $30 a year as an individual, and I believe it's about $70 a year for a family.
Okay.
Yes.
Other questions that people might have for our panelists? One down here. Oh, I'm sorry, you've got one right there? I'm sorry.
Well, thank you so much for the participants. My name is Raj Chaudhary. I'm the Executive Director, Advisor for SEVA, Asian Indian Family Wellness Program. And I see I'm trying to connect the dots about the language barriers and also the accessibility of the software. How is this going to work? Who is going to coordinate at the grassroots level, is my question.
It's a good question. How do we coordinate accessibility and language issues? Do we need to rely upon kind of government regulation to lead the way there? I know that in the case of Medicare materials, it was really government requirements that forced the production of those sorts of materials and information in so many different languages and on demand for languages not produced in.
Yeah, I would just add, it's really complicated, and I would add to it, that's where the human touch becomes really, really important. We're partnering with primary care providers that are serving really diverse senior populations, and English is not always the first language, and frankly, that's why it can be really hard for our primary care providers to staff nurses and medical assistants in their clinics, but we really do rely on that human touch to figure out not only the language barriers, but just some of the cultural differences and to understand it. And I think there's really no replacement for the human touch and the personal connections in that way.
Yes, so at the moment, Benji Health is only in English. But we do have plans next year to provide operability with other languages, with our first language being Spanish. But with this idea that, if people are accumulating their health history in Benji Health, over time, this body of knowledge becomes so useful to an individual. And people, coming to this country as adults, a lot of that material could have been in another language earlier before they came to the United States. Also, if your kids are in other countries, if your family speaks a different language. So we certainly do plan to add more languages to it.
And I'll just add one real brief comment. If I think back to when I first started with UnitedHealth in 2008, we would see reports on kind of ADA accessibility of our websites and things like that. And we weren't ignoring them, but we weren't treating them with the same degree of priority that they are currently being treated. And I went through a process at one point leading some site design, and accessibility was really built in from the beginning. I think that as a society, we're becoming much more tuned into and respectful of that ADA accessibility requirement. Probably time for one more question.
Thank you for the information. I'm concerned about especially the seniors who might be living alone and maybe don't have children in their area or have been independent. There's a stage where they might get Alzheimer or dementia kind of in between, and nobody really knows about it, and so they're going to have problems, say, with a system like you're proposing. So I'm wondering, what do you have as far as backup for that, and not to necessarily involve government during welfare checks where then they're exposed to all the information?
Mm-hmm. I think she's primarily asking.
Yeah, so obviously, Alzheimer's is really tricky. The average person lives with Alzheimer's for over 12 years and goes through various stages of the disease. And most of us have people in our own families that have experienced it. So I do believe that, it's a culture change, but, document owning your own health care before that happens, and being able to have, somebody in your life, it could be a neighbor, that's also involved in your care journey. Now, that a lot of people in our societies today live alone, so we do at times need to be more creative of who we turn to, whether it's somebody in our church or different organizations that maybe we're a part of. But I think it is so important to do it early so that when you are older, it does get more difficult. You have kind of laid that groundwork. But Alzheimer's is so tricky. Yeah.
I just add, I share that concern around social isolation. We all feel that to some degree. We see it a lot in these rural communities. And when we met recently with all of our primary care providers in South Carolina, on average, they had only seen 27% of their senior patients this year. So that's a huge gap of patients that just hadn't been seen. And if you haven't been seen, you might fall into that bucket of somebody that is suffering from Alzheimer's or dementia, or you just don't know what's going on. And so we've been trying to support by getting nurses to go into patients' homes so you can be the eyes and the ears and see what's happening, if there's adequate nutrition, if there's a risk of falls, just check and ensure that everybody's okay. It's not a government intervention. It's the primary care provider supporting their patients. If a patient isn't open to having somebody come into their home, we're trying to encourage at least a virtual visit so that there can be that connection. And if that's not working, then we're at least trying to get a telephonic call so that there is a touch point. But social isolation is really, really challenging, and I think one of the greatest barriers, and I'm hopeful that some of the technology we talked about today can help chip away at it.
Great, thank you, Kari. And with that, we've come to the end of the time that we have for this panel. I'd like to once more say thank you to Dr. Margaret LeClair Lett and Kari Seveson Snaza for joining us here on this panel today. I would once again also thank Jennifer Schaefer and the Medica Foundation for their sponsorship of the panel. At this point, you are invited to take a short break before breakout sessions begin. Breakout sessions will start at 11:15. Thank you.